Measles isn't a word doctors are used to hearing, but with cases on the rise in the U.S., they're doing what they can to learn more about the symptoms of a highly contagious disease. And Perrette explains what you need to look out for and who's most at risk.
The really challenging part of this right now is dealing with something that's different, that's new, that that we're having to get a handle on, and at the same time, dealing with something that's so contagious.
Measles can last in a room for 2 hours, or you could catch it from someone just 100 feet away from you.
Symptoms are start off with cold-like symptoms, runny nose, cough, sore throat, but after a few days then you start getting the spots and the high fever and just getting really, really sick.
Those most at risk?
People with immune systems that aren't really robust, like the very young or the very old, or people that have diseases like cancer where their immune system is knocked down.
And people without the vaccination, like babies who aren't old enough to receive it yet.
We can't vaccinate it until they're a little older, so they really depend on us around them, what we refer to as herd immunity. So we're the herd, we kind of circle them. If everybody else is immune, then you keep the disease away from them.
And just like the flu, measles can run into other complications.
They can get very sick from the measles themselves. They can develop this encephalitis where they get swelling in the brain, or they can get other secondary bacterial infections like pneumonia.
So doctors highly recommend patients of all ages get the vaccine and the booster.
The risk of having something bad happen as a result of the disease is far greater than the risk of anything happening as a result of the vaccination.
And
the measles shot is usually given at around age 1 or 1.5. Kids also need to receive the booster between 4 and 6 years old. Many adults should already be vaccinated. If you're not sure, doctors say there's no harm in getting a booster.